And we are live. It's Dr. J here in the house. Hope everyone is doing phenomenal. Today's podcast is going to be on the SIBO IBS connection. We're going to dive in to IBS and is it connected to SIBO? A lot of symptoms there. We'll try to look upstream, inside out, and get to the root cause of this. Evan, how are we doing today, man?
I'm doing wonderful. I was diagnosed with IBS in, can't even remember what year it was, several years ago by a conventional doctor who did nothing but look at me and palpate my stomach and prescribed me an acid blocking medication and then said, "Yep, you've got IBS." And that was it. So it's just crazy how many people get diagnosed with IBS. I should try to pull up some numbers on this and see, but I would say most people are undiagnosed because they're suffering, right? They're having
Oh, yeah.
diarrhea or constipation or bloating or gas, and they just don't go to the doctor. They just take an over the counter this or that and move on with themselves.
Exactly. And IBS is a disease, a diagnosis of exclusion, meaning you rule out a lot of the more inflammatory bowel issues, Crohn's, ulcerative colitis, a lot of those symptoms being like extreme weight loss. You rule out all of the inflammation markers like high amounts of calprotectin, blood in the stool, whether it's from inflammation in your colon, small intestine, or ulcerations in the stomach, right? So you're ruling out all of the big issues. Okay, rectal bleeding, extreme weight loss, extreme vomiting, extreme abdominal pain. Those kind of things are going to be the big things that we're going to be ruling out. And then, of course, we have, more of the in-between symptoms where we have constipation, we have some loose stool and diarrhea, we have some nausea, but there's not a lot of inflammation present. There's no calprotectin. We may run like a colonoscopy or a sigmoidoscopy where we're looking at the end of the colon and seeing no real signs of inflammation or bleeding. Maybe run a CT or an X-ray scan and see what's going on there. But we're ruling out like the strong pathological issues, but we still may have a lot of symptoms that I mentioned earlier. And so once we've done that, then you kind of fit the criteria of IBS. Now the question is, what's the root cause? And I've seen many times, we have one study right here saying that IBS is connected to SIBO and can be caused by SIBO between 1 and 40% of the time. This is in a study by the journal Gut and Liver in March 2017. We'll put the link below on that. So we know there's a strong association, up to 40%. And so we know there's a strong association. And when we have IBS, there's two major kinds of IBS, to keep it bluntly. We have IBS-D, which is diarrhea IBS. Then we have IBS-C, which is going to be IBS where there's digestive issues, but there's more on the constipation, the slow motility side and the faster high motility side.
Here's the interesting thing. The route of, I guess, the diagnosis of exclusion you mentioned, a lot of people don't even get to go that route because the doctor throws them the drug and sends them on their way. I mean, you talked about the optimal scenario where you get all the proper scans, you get your calprotectin looked at, you can measure your secretory IgA and look at your gut barrier. But that often doesn't get done. Often it takes multiple complaints, it takes multiple visits. Sometimes emergency room visits are required because they have to be in so much pain and misery for the conventional doctor to listen enough to then give them the proper referral. So I just want to point out what you said is that all these things are great, but a lot of times it doesn't happen that way in the conventional. We always do that in the functional world, looking into the testing, but that's not the first step for most people. And that's just the sad truth. And I don't know if it's a cost saving measure. I don't know if it's the insurance companies don't want to go straight to send you over to a gastro doc for deeper analysis. I don't know why, but I never got referred over until I had major complaints. And even when I got referred over, the gastro doc didn't even do a full workup. It was just a
Right.
quick 7-minute visit.
Exactly. So when they're looking at these things, they're just trying to rule out the more serious irritable bowel disease type of symptoms, right? Once that's been ruled out, you can still have a whole bunch of nausea and spasms and diarrhea and constipation. And then obviously headaches and fatigue and mood issues can result, especially if you're not digesting and absorbing a lot of your nutrition. You may have a lot more symptoms. And you're going to be typically left with just a few medication choices. So the big ones are going to be things that help with the diarrhea, various anti-diarrheal or anti-spasmodic medications. Okay. And then you'll have laxatives to help with the constipation, the slow side of the stool moving. That could be various laxatives. That could be Metamucil or fiber supplements. And then, like, of course, with some of the diarrhea things, antispasmodic medications tend to be used. And then also a lot of times antidepressants, because we know serotonin plays a huge role in the gut on motility. So conventional medicine's using a lot of antidepressants, whether they're tricyclic antidepressants, the older ones from the 80s, or SSRIs are also used. And then, of course, just the pain, right? There could be pain in the intestine, then pains are going to be used, whether it's like a gabapentin or something else like that. They're giving medications on the pain side. So these are the big ones that are going to be used. It's kind of cookbook, right? It's okay, fast stools, slow stools, pain, right? Pain medications. And then sometimes they'll give prokinetics for, your food sitting in there so long. And then, of course, the antidepressants. So those are the big four families of medication. So walk me through, how does any of that fix the root cause? It doesn't, right? The mindset is we're going to just manage these symptoms and hope that things don't get worse over time. And we know that with entropy and inertia, things always tend to go downhill over time, not better, if we don't get to the root cause, if we ignore the root cause.
Did you mention acid blocking drugs? Those are often thrown in with
yep.
it too.
Yeah. I mean, if that symptom is present, I mean, those are typical symptoms for IBS in general. But if we have IBS and GERD combined, yeah, acid blockers would definitely be used. Prokinetics along with that too. Prokinetics are just things that help with the motility and the migrating motor complex to keep food moving through the intestine. So yeah, you may see that as well. Yep. There's a lot of different scenarios where other, let's say, diagnoses or symptom presentations could overlap for sure.
Okay. So I just want to briefly dive into some of the other symptoms or things that could be happening outside of the gut. So like the mood issues that can happen. We've done stuff on this before, and we'll continue to talk about the gut bacteria and the mindset. So anxiety issues, depression issues, insomnia, irritability. There's a lot of other emotional things that people may not even recognize are from the gut. I mean, and this is coming from somebody who I suffered with depression for a long time of my life. And once I cleared up my gut, it was if the clouds over my head lifted. So I just want to point that out, that, hey, if you're suffering emotionally, it may also be your gut. So you have to start, in my opinion, you have to start there. Going to the mental health counselor may be necessary too. But for me, the game changer was getting my gut cleared out. My energy, my mood just went insanely good after that.
Exactly. And then what's happening there physiologically or biochemically? What's happening is when we have unresolved emotional stress, and it could be subconscious stuff where we may need to use techniques that help address things subconsciously. It could be just conscious stress where we need to just kind of write out the big issues and create some kind of an action plan that we can execute to get to the problem on it, whatever it is, if it's work or relationship or financial stuff, whatever it is, that's going to activate our fight or flight and sympathetic nervous system. And the sympathetic nervous system interplays with the adrenals, and that makes stress hormones to help us deal with that stress, whether it's adrenaline or cortisol. And cortisol and adrenaline long-term is very catabolic. So it's going to help, it's going to actually break down our neurotransmitters. So we'll have less neurotransmitters that can then affect motility, because we know that antidepressants are used for motility. So we know if we actually deplete our own natural antidepressants that we make naturally, serotonin, dopamine, we may have less of it to help with motility, number one. The more fight or flight we get into, the more we can actually break down our gut barrier. High levels of cortisol can break down IgA. I did a video that's out this morning. You can take a look at it on histamine intolerance. And in that study, there was an article talking about cortisol impacting IgA and the immune response and can cause more histamine when you're stressed. So you could have high amounts of histamine, which a lot of histamine symptoms overlap with IBS. So it could be skin stuff, it could be headaches, it could be fatigue, brain fog stuff, and a lot of the histamine issues overlap because when you have inflammation in the gut and you have a lot of cortisol stress, you may be making more histamine, and the gut bacteria has a huge impact on the kind of histamine you have. And we know that dysbiotic bacteria and or SIBO, which is bad bacteria from the colon migrating up into the small intestine, can have a major impact on histamine and on all the other symptoms we just talked about: mood, nausea, depression, anxiety, and then of course, your typical IBS symptoms: constipation, diarrhea, stomach pain, etc.
Yeah, well said. So you may come in with the diet, right? We may use the diet as like a modifying tool. Something like a low FODMAP diet may help, right? Because you're trying to reduce the things that are fermenting in the gut and possibly feeding the bad guys. But that's where a lot of people stop. is they end up with some diet protocol, like a SIBO diet or an IBS diet, and that's it. And they don't go any further. So they may be able to manage it, but that's still not the full root cause. What would you say about the diet piece and the involvement?
Yeah, so a lot of people, they come in, they may already be on a standard American diet, and then they're like, "Oh, okay, I'm going to make some diet changes," and they may still have issues. And the problem is, a lot of FODMAPs or fermentable carbohydrates are healthy foods. So a lot of people start scratching their head because they're like, "Wait a minute, I'm already cutting a lot of crap out, but I still don't feel good." Or, "Hey, like I'm following this Weston A. Price thing where they're telling me to eat lots of fermented foods. Why do I feel worse?" And this can happen because a lot of those foods are very fermentable. So the bacteria in your gut feeds on a lot of the carbohydrates in those foods. Those carbohydrates being from fructo, oligo, di, and mono and polyols. These are different kinds of carbohydrates or sugars that are naturally in these foods, healthy foods, but the bacteria will feed off of them.
Let's
And so
talk
that
through a
can,
few, just so people like, okay, what is he talking about? Like apples, pears, those are common fruits that are
yeah,
FODMAPs, right?
yeah. Those will have. So there's a really good handout that you can look at. I'll post my handout underneath, but these are different carbohydrates. So fructans are going to be high in fruits, oligo and di and mono and polysat and polyalcohols. These are going to be in different types of vegetables and foods. Now, there's an app that you can get on your phone called FODMAP A to Z, and it will tell you exactly which one of those FODMAPS in there, the different types of carbohydrates are in each food. I have a generalized handout that I'll put below that has all the different ones in there. And so you know, but the big thing is you just want to cut them out. And the goal is that you're starving out some of these critters by not giving the fermentable fertilizer so they can grow. You can starve them out. And that can be a good first step. Does that make sense?
Yeah, it does. And kombucha is an issue too. I remember I had a woman who she had extremely high levels of arabinose on her organic acids test, indicating she had a ton of candida overgrowth. She had toenail fungus. She had even fungus on her skin, like a fungal infection on the skin. This lady was drinking 5 kombuchas a day. Now, granted, that's an extreme case. Most of you listening are probably not drinking 5 kombuchas a day, but that just goes to show you can have too much of a good thing in the fermentable food category. And some people get crazy with it. They're eating sauerkraut every day. I just don't think that's necessary.
Exactly. So a little bit goes a long way, but if we have what I call probiotic intolerance, meaning foods that have good natural probiotics and it cause problems, there's probably SIBO going on, and there may even be an overlap with histamine issues because fermentable foods also have a high amount of histamine. So many different conditions overlap, and it's really, really confusing because you have to have a root cause perspective. Because when you go to the root cause and you're up here, lots of things emanate down below, various symptoms, various other diagnoses. And all a diagnosis is just a way of taking a whole bunch of symptoms and throwing them in one bucket. The problem is different buckets have overlap as well. So whether
Totally.
you have like a mast cell issue, that's one bucket, but then that may overlap with IBS. And then a lot of IBS symptoms, of course, overlap with Crohn's or ulcerative colitis or microscopic colitis, but they don't quite have as many of the inflammation signs. So there's a lot of different characteristics, and you have to, if you can go upstream, there's only a few root causes up here. So you get much less overwhelmed when you go up, right? You go essentially inside out, above, below, inside out. So you always go in to fix the outward manifestations and symptoms.
Yeah, well said about the histamine IBS connection. I don't think most people pick up on that. They go on like a low histamine diet, but they're doing it for what they think are histamine problems, but really that's the same thing as IBS problems. So the diarrhea could be a histamine thing, it could be a SIBO thing. So you really have to tease apart all these things. So how do you tease this apart? How do you approach these different buckets and then go up to the top? What's at the top?
Well, you need a good functional medicine provider that can help guide you because it's really confusing. And unless you've walked that path before, it's easy to get to glom onto one thing and then get overwhelmed. That's number one. And it happens all the time. And then number two, you can go down the path where you're kind of stuck on a whole bunch of medications that are managing issues, but then you're like, you're just trying to you're crumbling and you're just trying to hold everything up with duct tape, and it's stressful. So the first thing is you got to get the diet component under control. So we have to look at cutting out FODMAPs, maybe cutting out autoimmune foods. We have to really pre-digest and cook everything very well so we can digest it better, right? Think of cooking as pre-digestion. So kind of wrap your head, okay, cooking is pre-digestion. So a lot of people think, oh, raw is so good. Well, raw may be okay for some people that have great digestion. But if you don't have good digestion, there's a lot of fiber in there that could be hard on your gut. There could be a lot more fermentable fiber in there. Also, the fact that your just tummy has to work harder. And if you have less hydrochloric acid and less enzymes, which we know according to many studies show that SIBO patients have less acid, they're hypochlorhydric or achlorhydric, meaning low stomach acid. We know stomach acid is an important trigger to make enzymes as well. So if we have low stomach acid, we have low enzyme issues. And then, of course, if we're eating when we're stressed or we're not chewing our food up well enough, we're just going to not break those foods down. And then those foods are sitting in our guts, and it's a stress to break it down. So number one is choose good foods, but number two is pre-digest them with really good cooking methods and mastication, just chewing it up well.
Yeah, when I had gut bugs, I was trying to eat salad and it was a waste of time. I was not digesting leafy greens at all. So I just gave up on eating salad. And that's why a lot of people end up going with a more meat-based diet. And I've seen so many people, there's a lot of like famous YouTubers and other people who were raw vegans, and they end up getting off of that because they're just like, hey, it destroyed me. I couldn't digest anything. I was malnourished.
And some people, they go to the extreme of going full carnivore, which is definitely low FODMAP too, which does great, but some don't have to go to that extreme. And some people, they actually feel worse too, because protein and fats are also hard to digest as well. So sometimes there's less anti-nutrients and there's less fiber and there's less fermentation, and that's enough to allow them to feel better and heal. Others, they can handle some of those foods. They just have to be more autoimmune or more low FODMAP, and they really have to be working on the cooking methods. And of course, the next step is going to be supplementation. So we may work on adding natural prokinetics, things to help with motility. We may add in hydrochloric acid and enzymes. We may add in anti-inflammatory support for the gut lining, whether it's DGL or, like in my line, we use GI Restore, which is a healing nutrients for the gut lining. You have different things as well in your line as well. But we may come up with a plan based on how the person's presenting and things that have already helped or haven't helped.
Yeah, so it could be some herbal antihistamines too. You kind of hit on the IBS histamine connection. So part of what we do is teasing apart when to do what. So if we're trying to get someone's gut dialed in, they may be so miserable that we first have to use herbal antihistamines to try to calm things down. Let's use the example of somebody who every single food they eat, they have a food reaction. They say, I have food sensitivities. And we say, to what? And they say, to everything. And we say, okay. And that's where we could come in with maybe herbal antihistamines that you can take during the day to try to help regulate that mast cell reaction. You could look at the acid and enzymes, possibly probiotics, but usually that's like phase two. Usually phase one is more of us trying to manage the symptoms, get the proper information via the lab testing that we could talk about, and then make the game plan. And usually the game plan is going to have to involve some combination of anti-parasitic, antifungal, and or antimicrobial herbs. And often we combine those together.
Exactly. And then pre-digesting the food by cooking it well is going to be helpful. We can do a crock pot, which is great for pre-digesting foods and making more soup and stew-like foods. The only problem with the crock pot is foods can accumulate more histamine there. So if you're not feeling good with crock pot foods, we may need to progress more to an Instapot or a pressure cooker. And a pressure cooker is great because it cooks the food faster, so there's less time for histamine to develop. And of course, an Instapot's even better because that's going to be a hybrid pressure cooker and a crock pot combined. You just have to make sure with a crock pot, with an Instapot, you're very present when you cook it. So you have to make sure you release that steam valve before you open it up, or you'll have an explosion. So I always recommend, like, you put it way away from the shelf. Make sure kids don't touch it. Make sure everyone knows, like, you do not touch it. Have one person deal with it. Someone comes in that wants to grab a sneak bite of something, you're going to have an explosion. So just make sure you're very aware of that. And you have one person managing it, put it away, make sure kids are out of the room, and make sure that vent is vented and that little piton in the middle drops all the way down. So you know that thing is cool when you're opening it up. And I even recommend get like a fireproof blanket, put it over it, and then turn it.
Those things are, yeah, they're insanely hot. Good point about
you just got to be careful, because some women, or even myself, when I'm in the kitchen, you're just like, you're doing 10 things at once and you may just go right to it and not think. So you just really got to be very present when you're using an Instapot. Okay, this is how you got to do it. And you got to be very, very careful. Very mindful what's happening.
Yeah, they're incredibly hot and powerful for sure. I'm so glad you brought up the histamine issue with the crock pot, because, you know, bone broth is all the rage. Everybody's drinking bone broth. We measure their gut barrier. Guess what? Their gut barrier is still toast. Drinking a gallon of bone broth a day did nothing for you. And a lot of these people, if they're making their own bone broth because they don't want to pay the price of somebody else to make it for them, people are saying that they're letting it in the crock pot for 12 hours or 15 or 20 or 25 hours. That is a ton of time for histamine to build up. So I'm not saying stop doing bone broth, but I'm kind of saying that because I've had people that were actually having histamine reactions. They didn't know it was linked to the bone broth. They'd get these weird rashes on their face or on their skin. They'd get a headache and they had no clue why. And I would say, well, when do you get a headache? Oh, it's always in the morning. Oh, well, what do you do for breakfast? Oh, I drink a cup of bone broth in the morning. Take out the bone broth, no more headache.
And again, my opinion on this is bone broth for most people will probably be fine. So if you have negative symptoms after taking it, like Evan said, then you probably want to pull it out for a period of time and really look at getting the histamine out just for a period of time. And I just call it being histamine conscious, right? Look at the high histamine food list and really pull out all the ones that you are consuming the most of and just kind of watch and wait. But if you're consuming histamine or you're consuming bone broth and you feel relatively good with it, continue doing it. I have no problem with that.
Yeah, and sorry, I'm not trying to label a small population as the whole population, because you're right, that's not everyone, but there are some super sensitive people listening that may hear that little nugget and apply it and be like, oh yeah, I was sensitive and I didn't know it. But hopefully you're not in that category. Hopefully you're in the, you can do as much bone broth as you want.
And this is the hard part because there's so many caveats, right? There's so many exceptions, if, and, but, and that's why you really need a good provider to work with that can help you navigate because there's so many exceptions to the rule and we can't be absolute in our generalizations here. So take everything with a grain of salt for sure. And if you're working with someone that's individualizing approach, there may be an exception to it. So that gets really good to note. So outside of that, I think the food component's really big. I mean, have my 6R approach, which you kind of follow something similar as well, where we're removing the bad foods, we're replacing the enzymes. Second R, we're repairing the gut lining and or the hormones. The hormones are the X factor. People forget about this. I already highlighted how cortisol and stress and the sympathetic nervous system can affect digestion, but it also affects histamine. It affects the gut barrier. It affects the immune response. So the hormones are a big component. People come in there, there's a lot of, let's say, gut functional medicine doctors online, and they're so myopic to the gut, everything else blows away. And I can't tell you how many people I've seen that they're menopausal women that have ridiculously low hormones that are affecting their gut as well. They have low thyroid, which then affects their motility. Hey, that's a sign of SIBO and IBS, right? Also people that have poor adrenal function and they don't have enough cortisol to deal with the inflammation in their gut either. So you got to look at the hormones. That gets overlooked all the time. And then of course, removing the infections, which there could be different kinds of infections. And you got to know that it may not just be SIBO. Your SIBO may also have an H. pylori connection with it. It may also have a fungal overgrowth, SIBO and SIFO. There may be, like you said, Evan, where we had, I think the three amigos, right? I think we had blasto, giardia, and H. pylori. Is that what it was?
Crypto. You always mix up the blasto and crypto.
Yeah. So crypto, giardia, and H. pylori.
Equally terrible.
Yeah, crypto, giardia, which is worse. I mean, crypto is probably worse than than blasto.
Yeah, my gut was a mess. I was not healthy, man. I was malnourished for sure.
100%. All right. Anything else you want to add to that list?
The testing aspect, you kind of hit upon what we're doing, but not in too much detail. So we'll just kind of briefly cover that. Is primarily stool testing is going to give us a lot of the answers, of course. But as you mentioned here, you've got to get the other puzzle pieces. So you may need to run that cortisol panel. You may need to run that thyroid panel. So we may have to send you out to blood to get blood work because, as you mentioned, you could have someone with a gut motility problem that is not gut related. And how crazy is that? That it could be a thyroid problem causing your gut problem. Most people don't find that connection.
It definitely can, for sure. And I have a couple of questions that popped in regards to doing hydrocolon therapy. Is that helpful? My opinion about hydrocolon therapy, it's an extreme way to move the bowels. So if there's an extreme constipation, that may be a good way to start to kind of get things moving. But in general, there's a lot of things that happen in the colon where we reabsorb electrolytes and things like that. So I don't really want to disrupt a lot of that day in, day out. So I'd much rather use natural things to kind of move the bowels. If we have to do colon hydrotherapy acutely, fine. But long-term, we want more natural strategies that fix it. And of course, fixing the bacterial or the infection stressor that could be screwing up motility is obviously root cause. So there's a lot of natural things that I consider to be non-root cause like that. It's not root cause, but it's palliative and it may support it. maybe better than a lot of the medications or surgeries, but we still have to have our eye towards the root cause and more sustainable everyday things that are less invasive.
Yep. Well said. If I may mention the whole vitamin D connection, we wanted to hit on this a bit.
Oh, yes.
So there is a paper that had come out just a couple of weeks ago, October 2019, which was a study on ultraviolet B, UVB light, which you get from sunlight exposure. And you could buy like UVB lamps, I'm sure. And the paper looked at the implications of low vitamin D. And at the end of it here, it just talks about how seasonal fluctuations in the composition of the gut microbiome are found. And this is due to the different levels of UVB light. So basically, summertime, a lot of people say they feel better during summertime. Part of the reason is if you're getting more sunlight, you're actually helping to regulate your gut bacteria. And they found that the IBD flare ups were super common and linked to vitamin D deficiency. It says here, due to the gut dysbiosis associated with low vitamin D. And they go on and on and on, but that's the spark notes, is that low vitamin D equals gut dysbiosis equals irritable bowel.
Yeah, vitamin D can have a big implication. I think also vitamin D has a big connection with the serotonin receptor sites. And we know serotonin has a big connection with what? Motility. So I think it's all connected, right? I think vitamin D then connects to serotonin. Serotonin connects to motility. And if we're not moving our bowels adequately, then, you can start to have bacteria accumulating, right? Because low and slow motility can definitely cause bacterial overgrowth, right? The food's sitting in your gut fermenting longer. So when we look at SIBO, we primarily have hydrogen dominant SIBO or methane dominant SIBO. And those symptoms tend to correlate methane constipation, hydrogen diarrhea, and sometimes we can have a combination of two. That's the general correlation. So the testing that we would do with that is a lactulose breath test. And that's going to look more at small intestine overgrowth. We also have glucose breath tests, which you can look more at the upper stomach. And then there's the urea breath test, which is more of a newer test, kind of in experimental phases. But essentially, you're blowing into a tube, baseline, slamming down a 50 to 75 gram thing of lactulose, which is a large sugar molecule that does not get digested and absorbed, but gets fed to the bacteria. And when the bacteria starts to eat it, it starts spitting off gases. And the sooner in that 3 hours, so you get baseline, blow, slam down some lactulose, blow every 20 minutes for 3 hours. So the rule of thumb is it should take the lactulose about 2 hours to get into the colon. So typically at 2 hours, you'll see this double peak accumulate. And that's a sign that the lactulose has hit the bacteria in the colon. So the mindset is if we start seeing spikes in gases, right? Methane greater than 3 or definitely greater than 10 is a concern. Hydrogen greater than 15. Combined greater than 20, definitely a concern. We start seeing spikes in these methane and hydrogen gases, then we know the bacteria, especially if it happens before 2 hours, we know the bacteria is gobbling it up, and there's more bacteria because more bacteria equals more gases. So lower gases, lower bacteria, more gases. Of course, hydrogen-based bacteria, more hydrogen, methanobacteria, more methane. And on the GI map, we can actually, they're testing now various methane bacteria. So you can see some of that on the GI map.
I like that. Yeah, I was going to ask you, now that that's on there, how do you correlate that? Or do you do a breath test and you're going to run stool? Is it just in certain situations, or can you kind of infer from the stool now that may cause you not to run the breath?
So we know a lot of the bacteria that we test on the GI map, we know if it's connected to SIBO. So we already know like things like Pseudomonas and Klebsiella and Citrobacter and Prevotella and Morganella are already connected to SIBO. Now, do we know without a doubt that this bacteria is in your small intestine? No. I mean, it's like you have a toothpaste tube and then you have a little bit of toothpaste in the middle, and then you squeeze it all out, and then you try to infer after you squeezed it all out where in the toothpaste thing it was. It's hard to know that, right? You need a biopsy where you go in there and you either grab it in that part of the intestine, or you do the breath test where you can infer based on the time where it's at. Outside of that, I just say that you're making a diagnosis, a functional assessment of, hey, you have a general dysbiosis, and based on the research, we know that the bacteria that's high in your test is associated with SIBO. And then we
Yep.
can also try cutting out some foods and seeing what happens. Number two, if there's a strong history or a lot of symptoms, we may run a breath test alongside of it. It just depends. I typically don't recommend a ton of testing if we can do functional assessments and we see improvements. If we see functional assessments approving it, then that gives us enough ammo to say this is an issue. And if the patient's already getting better, that's the most important thing.
Yeah, well said. Because see, a lot of people get caught up on that. Like, where are the bacteria? What's the location? Do I have SIBO or not? And it's like, well, you've got Pseudomonas aeruginosa overgrowing. It's probably in your small intestine based on your symptoms. Let's address the Pseudomonas. And if your symptoms get better, it was probably in the small intestine. That's kind of how I approach it. I don't often run breath testing.
And you can also make some diet changes too and see,
Yeah.
like cutting out the FODMAPs, like I mentioned, or those kind of things. They can give you a pretty good window into it.
Yep. So yeah, we try to only do things that we see are going to help us create a clinical outcome. And in a lot of cases, my opinion, you tell me if yours is different. My opinion, the SIBO breath test doesn't add too much more to the picture if we get a really, really good stool analysis.
If we get a good stool analysis and we already make changes on the diet and the lifestyle and supplement side, and we already see things that give us a clinical indication of what direction we're heading in, for sure. I 100% agree with that.
Yep.
Okay,
Well, I
awesome.
think that's all I needed to say. I don't have anything else on this topic at the time, but I hope it's been helpful for people.
I think it's been really, really good. And of course, antibiotics can be helpful. More specific ones that are used in SIBO are going to be the neomycin and or the rifaximin or xifaxin. Those are antibiotics that tend to stay more in the gut and don't go systemic. Of course, our natural bias is towards the antimicrobials. There have been studies that compare the effectiveness of the antibiotics with the antimicrobials, and the natural antimicrobials have come up better in some situations. That being said, every now and then someone does better with antibiotics, but clinically, I found most people do very good with herbs, and they tend to do really well also because of the efflux pumps. The natural antimicrobials inhibit the efflux pumps, which is essentially, let's just say you're in a canoe and what you start taking on water, okay? The efflux pumps are essentially you in the canoe bailing the water back into the lake, right? That's the efflux pumps. So think about it. If we have a bacteria we want to kill, we want that water to accumulate in that canoe and sink the person or sink the bacteria. So the efflux pumps prevent that canoe from sinking. So the herbs tend to act like someone coming in and taking away that person's bucket. So then they can't bail out the water. And then the canoe or the bacteria takes on water faster and sinks. So you have some really good benefits with the herbals, with the efflux pumps. And then also the biofilms are another component. So the biofilms are like protective shields that the bacteria use from being killed. So things like ginger or silver or andrographis or systemic enzymes can be very helpful for essentially taking away the Spartan's shield, so to speak, and making them more vulnerable to the herbals.
Yeah, serapeptidase did a wonder for me. As soon as I started on that, I had
Yep.
massive sinus drainage, and I wasn't even someone who felt like I had any sinus issues at all. But once I started doing that, combining with antimicrobial, antifungal herbs, I mean, it was literally me peeling back the onion and hitting a new layer of infections, which is why sometimes on the retest, we'll see new bugs show up and people say, well, why wasn't this on the first test we did? Well, probably because it was hiding and we pulled it out of hiding.
Exactly. Any patients that are listening, they always see my ginger tea recipe or me talking about using ginger tea. Why? Well, one, ginger tea helps with inflammation. It helps with motility, but also it helps with biofilms. So I like to use things that have multifactorial benefit, and it's cheap, right? Helps on the digestive side, helps on the motility side, and helps on the biofilm side,
Beautiful.
and reducing inflammation too.
Beautiful. We could do a whole show on biofilm, I think, but yeah, it's definitely part of this puzzle.
100%. I did a video on biofilms. We'll put that in the references below. I did that a few years back, so that'll be a good reference for y'all. Silver is also a great biofilm buster as well. So in my line, we use GI Clear 3, which is a nano silver. And then of course we just make the homemade ginger tea. And I have a video on that too. So we got a lot of stuff for the references. And if you want to add anything for your video, Evan, we'll add stuff there too. That's perfect.
Cool.
All right. Any other questions from the listeners? Feel free and chime in. Again, we're one of the only podcasts out there where we try to really talk about real life experience with patients. We've had experiences over the last decade with thousands of patients, and then we take questions live because we don't need to prep for this stuff. This is things that we do every day. So, You don't prep for the book that you read to your kid at night because you know the language so well. We know the functional medicine language, and we're happy to be able to engage with you all on that. Let me see what we have for questions here. All right. How do you treat patients from a distance? So we have labs that we can order anywhere in the country or even the world. And then number two, we can always engage face-to-face via FaceTime or Skype or Zoom. And then of course we can make diet changes. We have a lot of handouts and video support, and we just engage via phone or Skype or video. It works great. I have IBS, constipation, and frequent urination, and a tingling sensation between my testicles and anus, and the doctor didn't know what it was. Any ideas? Hard to say. I mean, there could be some aggravation of your lower sacral nerves. If you're knowing that pudendal area is irritated, there could be a disc issue potentially. There could be a sciatic potential issue where that S1, S2, S3 nerve root could be affected. So it's hard to say what's going on there. I mean, people that ride bikes or things like that, that area can be compressed. People that have sciatic issues or sit too much could be compressed. So I need to have a little bit more info. But of course, if there's digestion issues, fixing that would also be helpful using all the things we talked about today. Evan?
That was great. I have nothing else to say except, you could run some testing, but that doesn't sound like a parasitic type issue. I agree with you. It sounds more nerve related.
Exactly. And how to get rid of colon pain that's caused by chia seeds. Well, first thing, if you're having a lot of colon or digestive pain, let's cut out the chia seeds. Let's cut it out for a period of time. See how we do. Excellent. And then another question here that's on topic is, does SIBO always come with pain? No. And this is weird. A lot of times SIBO may not even come with digestive issues. It may come with brain fog. It may come with fatigue. It may come with depression. It may come with symptoms not associated with digestion. And this is the hard part, where people that go to their conventional medical doctor, or even a lot of functional med doctors, they're, hey, if you don't have these gut symptoms, we're not going to run these gut tests, right? People become very symptom oriented in regards to what testing they're recommending. And that can be a big mistake, and people can fall to the cracks.
Oh yeah. Well said. Anxiety too. I've had a lot of people with anxiety and they don't have gut symptoms. And then we get their stool test back. I'm like, are you sure you don't have any gut symptoms? Like, how do you have this many infections and you have no gut symptoms? It's always amazing. I don't know if it's just a disconnect, if it's they're used to it. They don't know what their gut should feel like. They're used to their stomach being bloated all the time. And then we do a protocol and it's flat. And like, oh, I guess I was bloated. I didn't know that. Yeah. It's a great point.
Yeah. And then a patient writes in, what if you have gas when you're taking sulfur-based amino acids? So if you're having a lot of gas when you're taking sulfur-based amino acids, you just back off the dose and just gently taper it up. And I'd probably take it with food, so it mixes in with the sulfur amino acids of my animal products, and just kind of taper it up from there and go slow and get to a level where you feel comfortable. It's great. I think we hit all the major questions here so far. Anything else you want to add, Evan?
No, I'm glad we had some questions. It's helpful to dive into the real life experiences. So if people have questions ahead of time or in the future, feel free to reach out to us on our websites, Justin Health Wellness Clinic on Facebook, Instagram as well. Look us up, follow us, connect with us that way too, because a lot of what we do is kind of a thankless job. We're connecting with, hundreds of thousands of people per year, but rarely do we have people actually reach out and give us an actual, like, hey, I want you to cover this or this or this topic. Y'all kind of just sit there and wait, which is fine, but we would like the interaction too. So feel free to reach out and ask us questions. We'll answer them.
We appreciate it. Also, someone wrote in, yeah, our intestines, or essentially our GI tract, is our first brain for sure. There's what's called the enteric nervous system, and there's just as many nerves in our gut, in our GI tract, as there are in our brain, right? And our brain is essentially our central nervous system. That's brain to spinal cord. Peripheral nervous system is the spinal cord out to the extremities. And then of course we have the enteric nervous system, just as many neurons in the gut as in the spine and brain. So that's really important. So of course, having digestive issues can affect your mood, just as having issues in your brain can affect your mood. Your second brain, which is your gut, is so important. And of course, that's where all the building blocks from your gut go to your brain anyway. So all the nutrients and amino acids that make your brain chemicals come from your gut. So of course you have your own enteric nervous system there, but you have all the building blocks that come from there too. So really, really important.
Yeah. Just treating your brain is not the answer.
It could be part of it. And some people, it may be all of it, but most people, it's going to be a combination of the two.
Yep.
Yeah. And this is where you need that skilled experience. So feel free. And if you want to reach out to Evan, evanbrand.com. Evan's worked with thousands of patients all over the world. And then myself at justinhealth.com. And we appreciate you guys clicking below and writing us a review, as well as going to iTunes, justinhealth.com/iTunes, evanbrand.com/iTunes. Appreciate it, y'all. You guys have a phenomenal day. Take care.
Take care. Bye-bye.
Bye.